Irreverent, entertaining, cool. You're listening to LA Talk Radio.
You're listening to The Inner Voice with Dr. Foojan Zeine, only on LA Talk Radio.
Hello, everyone. I'm Dr. Foojan Zeine, and welcome to The Inner Voice Show. This show is about making a difference in your life so that you can create a free mind and a heart filled with love toward a fulfilling life. I'll bring you the latest research in the realm of human sciences, and we'll talk to experts in their fields to bring you the jewel of their knowledge and wisdom. I'm going to tell you about my book. So if you like to, you can go out to Foojan.com and get the Life Reset book. Life Reset, the awareness integration path to creating a life you want. It's the latest psychological model that has been presented to you in a series of exercises, which you can complete in your own time. The model, awareness integration model, has been researched extensively in different universities, and the latest one was published, and the latest one that was done was in Cal State Long Beach, and this study was resulted in 68% decreasing in depression and 27% reduction in anxiety, and that was in a self-study format. Other research that we've done as a therapy and a counseling face-to-face with clients, the result showed of 76% of decreasing in depression and 63% reduction in anxiety. So if you want to get a copy of the book, you can go to Foojan.com, Foojan.com, or just Amazon. And if you like to consult with me, I have an office in Irvine, Woodland Hills, and Brentwood in California, or I can talk to you online. So again, go to Foojan.com, and I love to hear from you. We'll be right back with an amazing guest that we're going to talk about sex. Yes, don't go anywhere. We're coming back and talking about your favorite subject, sex. So usually at this time, I'm going to tell you about some kind of the latest research that has been happening. However, the reason I'm not doing this today is because I actually have the researcher right here at the studio. I feel so lucky. So I have with me Dr. Mitra Rashidian, who has a PhD in counseling from the University of New England School of Health in Australia. She's a licensed marriage and family therapist in full-time private practice right here, close to our studio located in Encino, California. She's a certified sexologist through the American College of Sexologists International and is an honorary adjunct faculty member at the School of Health, UNE. She's a research member of the Collaborative Research Network in Australia, and she further completed a 2-year postdoctoral fellowship where she led her research project that included the University of New England, School of Health, Australia, University of California, Irvine, School of Medicine, Loma Linda University, School of Health, with the research focus on sexual health and mental well-being. Don't we all need that, sexual health and mental well-being? I say yes. So Dr. Rashidian is an internationally recognized speaker in the area of sexual health and cross-cultural sexuality. She has presented her research findings both nationally and internationally in places such as the UNE, the American Counseling Association, the American Canadian Counseling Association, the World Congress for Sexual Health, Glasgow, United Kingdom, and the University of Ehau. I don't even know if I said that right, but in South Korea. The results of her research have been published in notable scientific journals such as the Biomedical Health Services Research Journal and the Journal of Culture, Health, and Sexuality, an international journal of research, intervention, and care, Routledge Plus, the Journal of Sexual Medicine. She's been featured as a guest speaker on both international television and radio programs, and now we have her here. Additionally, she has presented at continuing education workshops in California with a focus on multicultural sex therapy, subcultural physicians, clinicians' knowledge and role in sexual health care, and sexual addiction at workplace. She has a private practice in Encino, and she works on enriching and sexual interest and behaviors, plus the impact of culture related to shame and guilt and social emotions, which inhibits the expression of sexual feelings, pleasure, and intimacy. Welcome, Dr. Rashidian.
Thank you. Thanks for having me, Dr. Zeine.
My God, from Iran to Australia to United States, and right here in Sherman Oaks with us. So sweet to have you.
Thank you. Thanks for inviting me.
And what a beautiful concept to just research on.
Yes.
Do you have as much fun as we have in hearing it?
Well, as a matter of fact, when we talk about sex or sexually related topic, despite the fact that the myth that it's a fun topic, but it's still, when we get to the depth part of it, it's not.
Yeah.
And there are lots of emotions, feelings, myths, misconceptions, and other factors are associated with human sexuality that primarily, takes away some of what we think is fun.
Mm-hmm.
And we get to the root cause of many painful events, memories, experiences, traumas,
yeah.
And therefore sexuality, now we know it's a psychosocial phenomena. And with that, from sexology perspective, we know that only like up to 5% of issues are biologically related. And the majority of issues are coming from social factors, cultural factors, the do's and don'ts, the prescriptions that they are socially constructed. And of course, when they are imposed on people, in particular women, we know that there will be, psychological outcome of it, negative experiences, which may manifest itself into the physical symptoms. But the reality is that, when we get to the root cause of the problem, we go back to the social factors.
Two things that I've experienced with my clients for the past 27 years, when I've worked with couples or individuals, Dr. Rashidian it's a very vulnerable subject to talk about.
Absolutely.
And people usually don't share with their mates, with their friends, with even experts. People have a lot of problem even when they come to my office to even talk about sex.
You're absolutely right in that, and that's exactly how this entire process for me started about 20 years ago. This whole research process was based on my own observations, interactions, and lack of literature review about, Iranian American woman, sexuality. And my question was, why each time I have a client and, we talk about relationships, and there is a talk about, sexuality and sexual aspect of their life, they just didn't want to talk about it.
Yeah.
But they always complained about physical symptoms, and the prime physical symptom was abdominal pain, which didn't make any sense. What was that all about? It was based on those factors that my team and I, we decided to do our first quantitative study about, doing our first quantitative study about the root cause of this sort of, reluctance to talk about sex and sexuality and experiences. We designed a survey, and then For that, I needed physicians' help. I interviewed with a number of Iranian American physicians who were willing to help us with our research process. And it was through them that we were able to find candidates who were willing to complete the survey and to return it to us. And of course, everything was confidential. We went through ethical process, we got grants, and finally, our researcher, we did a statistical analysis, factor analysis, all that work, only to come back to the point that these women, they just refer to their sexual discomfort as abdominal pain. The symptoms were similar to what we used to know as vaginismus.
Yeah.
And it just didn't make any sense. Now, we retested and retested our data. Everything was complete. And there was no error, but still the answer that we had didn't give us more data that we had at the beginning. So that needed further information and further investigation. And it was then that I went to Australia for my PhD, and we chose narrative analysis and feminist perspective, so that we can hear from women, in depth, to talk about their perceptions of their sexual self. How was that, developed? What factors contribute to that? How did they come, to the idea that as a sexual beings, how do they, look at themselves? How do they understand themselves? That process took about almost 2 years for me to find participants and for them to be willing to sit down and do, individual interviews. And of course, the first couple of, interviews was successful. Again, I received the participants through some of the physicians, and then it just took the snowball technique.
Right.
So everybody, informed each other, and one at a time we find the right candidates. And we did the interview, and of course, per policy that university had with me, again, everything was confidential, and I had to do all the transcribing, all the interpretation and everything.
So what were the findings that you find that can also, one can be on a cultural level, which is a single cultural concept, and being in Australia, seeing patients who were not necessarily Iranian American, or here in the United States, what is it that you sense that might be a culturally referenced concept of a perception about a woman in sexuality versus, like American or Westerner?
Right, that's a very good question, and actually, the steps that we took in order for us to do a complete analysis of these narratives and to come up with the right interpretation, something that was meaningful according to the stories, we looked at 3 areas of life. One was childhood, the other one was life during adolescence, and then marriage, and also migration. So to see how migration, was impacting this process. I have so much beautiful narratives, so many beautiful quotes of these participants that each one of them talk about their life experiences, how they grow up as girls in Iran, what was their outlook, how they were told certain things about their femalehood, their womanhood, and how they applied that to themselves, and it just became part of their belief system about who they were as women, as young girls, and how they accepted the do's and don'ts for themselves, and that became the blueprint of their sexual self eventually. They have talked about painful events, they have talked about traumas, they have talked about challenges, they have talked about what they didn't know, and then they believed that was the right way of having their life, until they came to United States, and that's where the clashes, started. And
because
actually
the belief
bigger-
systems are different.
Right.
So what are the belief systems that are different? Not necessarily how you did the research, but what are the belief systems that are necessarily maybe different from like a Middle Eastern woman or women who are raised in cultures that are more, let's say, restricted, or they have different values for women and men versus maybe the Western culture as they come in? How do you see those values different as basis of, you've done more than 14 or more
Right.
studies that you have? How do you see the end results where as our listeners listen to this, they can capture and find themselves in how maybe the way they grew up, what type of belief system they heard from their mothers, from their culture, from their family system, that maybe it's still installed in them. Or, for example, as you said, their adolescent years, where with their peers, they were talking about these belief systems and how those belief systems made who they are, and then, when they actually had a sexual experience, and then after marriage. What are your experience with all of the data that you got between these cultures?
The experience at home culture for sure taught them to be passive, to maintain family respect in the name of, we have this concept called Overrule.
Yeah.
To be a khanum, with that.
To be a lady.
To be a lady. And that primarily is one aspect of what the majority have experienced.
Right.
Actually, I would say, all of them experience. And then, of course, certain restriction in behaviors, like certain activities prohibited for girls, certain way of talking was limited for girls, and decision makings definitely needed to be consulted, whereas for boys, these women didn't see most of those restrictions happening. So, and of course for girls there was the issue of virginity, maintaining their virginity, and not to have any relationship outside marriage and save themselves for their marriage. And these women talked about the level of difficulty that they experienced, how they felt sexual at times during puberty, but they didn't have any information, any knowledge. They didn't have people to go to, no permission to discuss. And therefore, the sense of confusion that they grow up with was profound.
Yeah.
One of them was and also, some of them that they had traumatic experiences, like unwanted experiences with cousins, with other people that had permission to come to the family, close relationship with the family, and they were fearful about how to bring up the fact that they were traumatized as a result of sexual assault and even rape. So they had limitation about discussing those aspects of their experience, sexual experiences. Altogether, when you look at it, during teenage years, during adolescence, they already formed the concept and the belief that sex was a shameful act, it was sinful act, and they just needed to stay away from it. But the problem was that as soon as a marriage happened, and of course we're talking about first generation Iranian American, as soon as marriage happened, all those prohibitions were suddenly waived.
Right.
And now they had to be this active, knowledgeable, sexual, being, and to satisfy their husband's need, and without even knowing what is that satisfaction meant to them.
And most of these people, their husbands had already been sexually active
exactly.
with other women from other cultures, which
Right.
were pretty open in
Right.
expression of sexuality.
Yes.
So to come back and go with someone who's not only a virgin who doesn't know what to do and
Right.
doesn't have the skills, but also is prohibited
Yes.
in order to be that free.
Right.
Now there's a really a dichotomy that happens between the two.
Right. So then there was a learning process about sexuality, about their sexual self in Iran, and then there was a marriage process, and they had to apply that sexual self within marriage and without knowing what was going on. And many of them were very young at the time of marriage. Some of them were even below age 18. And I have a few of them that they were 14 years old, and their father signed for them to get married. Now, this may sound such an old concept, but the reality is that we still see some of that here in Los Angeles. And I see, the same perception actually that's been transferred to second generation. And that's the surprising part. We're talking about a generation that is born and raised here, and it's right now about at an average of age of 35. We're looking at that they are still carrying. So we know that these transfers, all this belief system, and actually I wrote an article about that it was published in Culture, Health, and Sexuality, and the title of that is "My Culture Haunts Me No Matter Where I Go: Iranian American Women Discussing Sexual and Acculturation Experiences." So
I would see that also, and I don't know if you did more research on around the Middle Eastern culture, or let's say the Islamic culture, or even the let's say a very conservative Christian culture, or a very Orthodox Jewish culture. So you could see some of the same ways of being and messages kind of being across some of the other related religions and cultures.
Absolutely,
too.
That is correct. Despite what we think, for example, we think that this situation is only limited to conservative cultures, but the reality is that limitation on female sexuality is everywhere, even in the United States. And so we have so many conservative families that we don't know that they exist, because their appearance, what they do, in society, doesn't suggest that they are coming from that kind of a perceptional background. But the reality is that yes, we have this everywhere. But of course, in cultures like Middle East, of course, that is more. In some of the Asian countries, that is also very more, and African countries, that's significant. We can see that. And North Africa, definitely, we can see that. But we see much less of it in
Western European and Western world.
Right, you don't see that in Norway, you don't see that in Switzerland, or you don't see that in Holland. So those countries, they have far less restriction when it comes to female sexuality.
And yet there is also, as we can hear it with a Never Again movement, Me Too movement, a lot of the movement that's happening now, that there's still definitely a shift and a bias when it comes to female sexuality versus a male sexuality, where the male has the authority and the power of pursuing and acting upon the desire as they deem it necessary, or as they desire, versus the women who are mostly, and I can't say all, but mostly are recipient of what the world will bring to them, versus an active part of setting boundaries, saying no, or even pursuing.
Yes, that is true. I mean, what we're talking about now is about the impact of patriarchal system, on women's life. And the reality is patriarchy exists everywhere, in the world. In Middle Eastern countries, and the countries that I mentioned, of course, there is more, significant, and we have within each country, in each region, we have also plus minus level of patriarchy and how they reflect on a woman's life. But then again, there are cultural do's and don'ts that we see, for example, in the United States, that through all the commercials, through all the media, they prescribe to women how they should be, how they should act, what looks good on them and all. So these are all reflecting on a female sexuality.
Yes.
And then in relationship to men, they try to, I don't know if saying they design themselves to look like the same way that men really want to look at a woman,
or at least the commercials say they should.
Commercials say they should, and then that definitely, you know, when a child is a female child is exposed to all that in messages, not just only within the family, but you know, outside the family, at the school, at the larger society. So as much as when they become exposed to this from childhood, you know, that becomes part of their synapses. It becomes part of, you know, perception, and it just becomes automatic, you know. So working with that probably is the hardest part of therapy, as how you change somebody's perception, and they need to feel safe to do that. They need to be able to find a place to practice. So that's really essential. And then the role of what's really is significant is the role of clinician in these situations, and how clinicians are able to help women to understand the truthness, the true self of who they are as sexual being. That is one of the areas that I came across finally after doing like half of my research, like about 10 years through my research, that it was I realized, oh my goodness. So we're working on women. That's beautiful, but there is a population here that's in charge of helping women. And how's that working? What about their perceptions? You know, what's going on there? And this information also came from narratives. It was the women themselves that they told me they had a hard time talking about their issues to physicians, to therapists, and they just didn't know what to do. And it was then that it was decided, my team and I, that we need to at least, you know, do a research on Iranian American clinicians to see what's going on there. How come they just don't talk about it? How come they just let women let go when they say they have abdominal pain? Okay, what do they do with that? How do they come up with treatment? How do they make sense of what is that abdominal pain? Abdominal pain is a large area. So how do they determine what's going on with the woman sexually? Because when I interviewed many of these clinicians, they said, we don't talk about it. So they don't talk about it, patients don't talk about it, so what happens to people? You know, how do they take care of themselves?
Well, I think what I've sensed with, regardless of the culture, I think what I've experienced in my office with my clients when it comes to sexuality, interestingly enough, there's a lot of differences among couples, obviously, the same way that they're just different. There's a lot of difference between them, but the ones who just do not talk about their sexuality because they feel shame or they feel vulnerable about it, or that they don't know even how to talk about sexuality, of what they need and what they don't, and what they like and what they don't. And when the conversation is not there freely, that internally each one of them comes up with their own rules, with what they like or they don't, and then they somehow just kill off desire for themselves versus for it to be an area that they're really actively working on. They kill off that space. For some reason, for people, I've noticed within the past 27 years that it appears that just like eating, they think sexuality should be natural. And not only that sexuality is natural, but the skills aren't the same way. Yes, the desire to eat is natural, but cooking is not natural. It's a skill that you got to learn in what to cook and what to eat, that it, you know, fits for you. What is your desire? What is your taste? And if you take the same concept of naturalness within sexuality, each person really have their own taste of what needs to be done. Something that I've noticed, and I'd love to for you to shed some light on this, is With many other aspects of cognition and the way that we view life and the world, when we change people's perception and they start acting upon the new perception of how they like the world to be or how they like their life to be, or they get skills in how to do things, it really enhances their life. One of the things that I've seen in sexuality is, in some level, in some percentage, it enhances their sexual life. But there's something about sexuality that is an acquired taste that happens. Now, the acquired taste can happen at any time for any reason, that the person gets turned on or attracted or by a particular way, smell, position, behavior, any of it. And regardless of how you consistently change those, that the desires and the way of being of what turns you on and off kind of similarly stays the same. So part of what we had a problem with as clinicians is that no matter how much you work on their relationship and intimacy and getting close and talking about it and all of that, somehow still the desires weren't changing, or they would be able to do things in an active way where they acted differently together, but something internally which was installed in a way in them since childhood or teenagehood, would not shift. Their temperament wouldn't shift. There's a resentment that got built. So it's very interesting that although, because you talked about therapy and clinicians and all of that, therapy works in many layers on many aspects of life. In sexuality is very different.
Yes.
Can you talk about that, since this is your expertise and this is what you do every day in the office?
That is correct, yes. You know, I don't know if you know, but one of the famous French philosophers, Michel Foucault, who's my hero, he said that sex is a core part of a human being life. And imagine if that is damaged during childhood, and a child never had a chance to explore the experience, to understand the experience, to make sense of what happened to him or her, doesn't matter. And they just grew up with those unexpressed feelings. It becomes sort of a acceptance that this is how their sexuality meant to be, that they are eventually, of course, not receiving any help, any treatment. It impacts their self-esteem, it impacts their outlook to life, it impacts their outlook to themselves at the end, that negatively, and then they just continue with that. So unless that part significantly is targeted, when that person is aware, so it doesn't matter they become a teenager, it doesn't matter they become an adult, but profound in-depth therapy is needed to heal that part that's been significantly broken. But having said that, when it comes to adulthood relationship and sexual activity, we usually, what I see in my practice and what I have seen from narratives, and my other colleagues have told me, there are couples come to us and they talk about a significant problem. For example, vaginismus, right? For example, lack of desire, or erectile dysfunction, or arousal dysfunction, all of that. And one couple, one partner says, fix this partner because he or she is with a problem. But the reality is, sexuality, having sex, it's a relationship.
Yes.
And unless the two partners are on the same page and they are willing to look at how they're contributing to this relationship. One person cannot just heal unless there is an organic reason there, which is only that less than 5% of the situations. So looking at the nature of relationship, looking at the nature of communication, looking at what is their sexual education altogether to begin with? Did they just learn it from porn? Did they just learn it from a magazine? Or how their ideas, their perception comes together, how they can meet each other's needs, and how are they able to communicate about what they want or what they don't want. And that communication part, it's so profound in sexual relationship. And also how to feel safe with each other, to be able to talk about their desire in sex relationship. And that is significantly, all these factors are significantly lacking in our community. There is no foreplay. There is, I had a client, a couples, and several of them actually, that they said, foreplay turns them off. They just want to go for sex. But the reality is that, if foreplay doesn't happen, a female anatomy is not ready for penetration. Because that foreplay allows a woman to lubricate, to become aroused, and therefore to be able to accept penetration. Without that, it just doesn't happen, and that's one of the reasons that women feel pain during sexual, activity and intercourse. So if that communication is not there, if understanding of each other's need is not there, if men they don't want to accept that a female takes longer to become aroused, and just because a man wants to have sex, his partner cannot just be ready in a snap, and they need to understand that. And then for a group of people, a culture that they do not have that experience, and everything is about what a man wants, and sex is about men, we're going to have major problem as we're having.
Yeah.
So healing what has happened in the past, being able to talk about what has happened in the past, exploring how the person relate to that experience, it's significant in healing sexual trauma. Without that, the person can go on and have a relationship, even have a good sex life, but it's not great, it's not fulfilling. It's at the end of the day, something's missing in the person, in the individual life. And we also need to know that sexual trauma, may leave a permanent mark on a person's mind about, herself or himself. But definitely that can be resolved through the right therapy, and then having the ability, the peacefulness, the trust that they can talk to their partner. Partners play a profound role in sexual relationships. The level of trust is significant, and if it is not there, mechanically sex can happen, but
yes.
Emotionally,
it won't be there.
It won't be there.
Yeah.
No.
And I also want to reiterate about the communication, as you also stated that with your findings that is so important for the communication between the couple around the sexuality. One of the things that I've sensed where it stops communication, even if there's an intentionality, because part of it is, okay, there is not a knowledge about that I can talk, or that since this type of conversation, I've never had a role modeling of I don't know how to, so it's kind of awkward or odd for me to talk. And then there's the third one, which is even when people want to talk, they only converse when there's a complaint or a problem, versus to be proactive about what you want and create that type of a play, versus when something is not appropriate or you don't like it, that it turns around as a complaint to the other person that you're not doing something right to me, or I'm not being satisfied, or and I think that type of a communication, then it makes the partner very vulnerable and more in a defensive, which is a turnoff. Like instead of this shifting and bringing people together, this type of communication then adds to a turnoff and a performance anxiety in the next level. What would you advise or give tools to our listeners in how to communicate together when it comes to sexuality?
Right. That's a very good question. That includes looking at the level of empowerment, the level of assertiveness, the level of where one is in for example, her relationship, right? If in patriarchal cultures, obviously the role of a man and woman differs from each other for the most part, and there's usually the situation of one up, one down position. That means male has the upper hand and the female has the next level down. And that by itself creates inequality in sexual relationship. That's the beginning part of it. And if somebody, a female, has already grown up with the notion that, I'm a woman and therefore I'm less than. Now, maybe consciously they don't say that, but unconsciously that's already there. So there is some level of vulnerability there already about, how they can be expressive about sexuality. Some of the narrative actually reflected on that, and to the extent that because of not being able to reject or to refuse or to stop, sexually demand partner, they talked about rape within marriage and how the fact that they thought they can stop the request and they have to respond to the request, they felt being raped by their own husbands. Assertiveness is a skill that women who experience difficulty in expressing about what they want sexuality is essential. And also to understand what makes them feel, less than, what makes them feel not empowered to be able to talk about their desires. Now we're talking about education. Education is important, right? But then again, like you said, how do you put it in practice? The way you put it in practice is by just talking about them and talking about their feelings and how each action, how each approach makes them feel like. If women are able to recognize what works for them in sexual relationship, then they're going to be able to explore more and then explore further in order to be able to connect to their partner. And also we need to look at the realistic demands of the partners from each other. How what one is requesting is realistic sexual act. And then just because somebody doesn't know what happens during a sex episode, it doesn't mean that a male partner can just demand what they want, because that may be very hard on most women, actually. The other problem is that when women are not empowered, don't feel empowered, or they're not assertive, and men, of course, watch porn, and what they see, they demand that from their female partner. What we see in porn, it's a 5-minute episode of a hot sex, but it has taken like about 3 months for that 5 minutes to be built. Mm-hmm. It's not going to happen in a regular, sexual activity between two partners. And having that, expectation is totally out of the picture, and it only causes more trauma. And this is something that, we work on as part of sex therapy. This is the educational part of it. What do you want from each other, and how do you, both of you, approach each other? What's the expectations, and how do you feel when it comes to all these expectations, and how one ultimately gets so hurt that rejects participation in sexual activity, and how one becomes more aggressive. So these are all, working with perception, working with thoughts, working with feelings and beliefs, and all of that is a constant work that helps couples understand each other and come to a agreement at some level that, you know, what needs to be done, and ultimately what feels good to them.
Yeah. I know that there's a lot of conversation about language of love.
Yeah.
And I would like to add that there's also a language of sexual attraction, that what I would be attracted to does not mean that it simultaneously is very attractive to my partner.
Right.
The same way that if my expression of love comes from maybe being touched, maybe my partner needs to be heard and hear the love words. So we have begun understanding that the couple's love language is different. But somehow there's an expectation that the sex attraction language should be similar, which it isn't. It's so different.
It's different.
And if we recognize that, and then not only to request what makes us hot and attracted, but also to find out what our mate gets attracted by, and to be able to fulfill all of it, fulfill what we want and what they want, so that it becomes a mutual attraction piece.
Exactly. I mean, having an understanding of each other's sexual self, desires, wants, emotions, feelings, what sounds erotic to them or what doesn't sound erotic to each other is really essential. Also, another aspect of sex is that it's not always about having an orgasm. It's not always about having full intercourse. But most people make a mistake in that they say if they don't have orgasm, so that means there is a problem, or if they don't have full intercourse, then there is a problem. The reality is that a major part of sex and sexuality is the togetherness, is just connection, is just the emotional and physical connection in a safe way, in a way that's fulfilling to both partners. And intercourse and orgasm is an aspect of it. It's not the full picture. And there are many things that couples can do to satisfy each other. Actually, I tell my clients, why don't you have a date night? I mean, most people forget about that beautiful part of just letting go of everything else and just connect together and have a date night. And they say, oh, well, how do I get a date night with my husband? Well, what did you do before getting married? Why don't you do some of that?
And sometimes it's great to make love, and sometimes it's great just to have sex.
Just to have sex.
And sometimes it's great not to have intercourse and just, look at each other's eyes and
just
make out.
Just holding a hand, just cuddle.
Make out like when you were in a teenage years, making out.
Yeah, it's not like about what you see on porn. It's not what you hear from your friends. It's not what you see in magazines or movies, It's about how you're able to connect. It's about how you're able to communicate what you want, what you desire, what feels good to you. And these are, communication, no matter how we look at it, communication, education, awareness, assertiveness. These are all aspects of, a healthy sexuality for most people.
And also learning about your own body. I think that many people don't know about their own body, and they don't know about their own desires.
That is true.
So the responsibility of getting to know who you are.
Yeah, many people don't even, female in particular, again, from all culture, they never had a chance to touch down there. They don't even know their anatomy. And then for me to show them pictures, to have them experience, touching themselves. Masturbation is a part that many of women, they think it's a sinful act, but the reality is, of course, anything when it becomes too much is not healthy. But then again, when it comes to getting to in a healthy sexuality, a woman needs to know her body, needs to know what feels good to her. And that doesn't happen unless she puts that into practice without feeling shame, without feeling guilt, without feeling sinful. And that's part of her body. All of our body is beautiful, including genital, and needs to be recognized, appreciated, and valued.
Yeah, and being responsible for
responsible
creating, sexuality as fun and play, because it really is fun and play.
It is.
So, Dr. Rashidian, how could our listeners find you?
They can find me online. They can Google my last name and my first name, and my phone number and everything is online. I don't know if they can call me.
Go ahead, give your number.
Yeah, it's 818-745-1014, and I'm located in Encino, California.
It was a joy to have you. Thank you.
Thanks for
and
having me.
of course, and we would love to hear about your new research as it comes up, and
Thank
you can
you.
come back to tell us all that you have learned more and more to and share it with our listeners.
Thank you.
Everyone who have been listening with your heart, create a wonderful day, a week, a life for yourself and everyone around you. And hopefully you're going to also this week be more and more conscious and aware of your conversations that you have in your head and sensations that you have in your body. And play. Just go ahead and play this week in a way that is fantastic for you and your partner. Take good care of yourself, and until next week, take care.
You're listening to The Inner Voice with Dr. Foojan Zeine, only on LA Talk Radio.